You are joining us from Naspoti. Thank you for joining Bonitas Sounds Call. Good morning. Garth. Yes. I hope... Garth, are you still with us?
Yes.
Yes, Major. Your question, please.
I'm phoning from Nelspruit, Mpumalanga here. Problem I had about 2 years ago, I picked up like a sinus type of thing, which I think all headaches, I'm not quite sure. But let me explain to you how it is. It's like somebody sticking a hot soldering iron up my nose. I've got just between my eyebrows, I get a sharp pain and my eyes start water, and then I get like earache and toothache at the same time. And I get pains behind my ears and then behind my neck muscles as well, and it's quite intense. Now, I found out sometimes the way I know that it's occurring is that like my body temperature picks up, like my head wants to like explode, like, and then suddenly I get the pains. And the thing is, the pains are so severe, and I'm 40 years old. It actually feels like I want to
How often does this happen, Garth? We don't have too much time. How often does it happen?
Sorry, it's sometimes I get it about 4 or 5 or 6 attacks a day.
Okay. Drop your phone and listen. I'm making a spot diagnosis, cluster headache.
Cluster headache.
Thank
Absolutely.
You give me 100%.
100%.
So I'm a good student.
100%.
Cluster headache. Typical. Yes.
Typical.
Can you tell Garth what it is? He's got a cluster headache, that's the diagnosis. What treatment does Garth get?
Treatment is very difficult. One of the things that we do, the simplest thing, is 100% oxygen. And you can give him oxygen during the attack.
Okay.
That works very well. The sumatriptan, the Imigran, injectable, you get an injectable, subcut injection, works like a charm.
Subcut is just under the skin.
It comes with a pen set.
Okay.
So it's like the diabetic injecting themselves. Same thing, you just inject yourself when this headache starts, works like a bomb, right? In some of them, especially him with a nerve block, occipital nerve block, breaks it. Works like a charm.
Now he's in Nelspruit. Where does he get this kind of treatment?
Well, he should first start with the oxygen and the sumatriptan. That you can get from... Nelspruit has got neurosurgeons, Nelspruit has got physicians, it's got a private clinic there, it's got hospitals, it's got pharmacies.
So he can
go to his GP and get that treatment.
Okay.
Right. The problem with a cluster headache, the acute treatments I think we've got worked out. The problem is prevention.
Okay.
And when they get this, like he says, 4 to 5 or 6 attacks a day, and they last less than 20 minutes, right, usually in males aged 20 to 40, so he's at the end of it. What I'm saying to you is the prevention is the most difficult thing.
Okay.
Right? And the drugs that we use to prevent them are quite...
The medications that we... Let's avoid the
drugs. Medications. The word drug is a bad idea. The medications are not without side effects.
Okay.
The best one for prevention is lithium.
Okay.
It's a drug that the medicine we use for bipolar.
I know.
That works very well. But you always combine it with an anti-inflammatory. And the anti-inflammatory that works as a preventative for this is indomethacin.
Indomethacin. Yeah. Okay, let's leave it at that. The best treatment for tension headache. We know that you must avoid the tension, you must avoid the stress. Where possible, you must get a clinical psychologist involved. Where an identifiable cause has been involved, has been picked up, then you can also use services of a psychiatrist. But at a physical level, the best treatment for tension headache, what did you say?
At a physical level, there's no doubt that an appliance that you wear in the mouth, which causes muscle relaxation of both the jaw and neck muscles, because don't forget, the neck and jaw muscles work together to keep the head level.
Physiotherapy?
It helps, but we use that as an adjunct. The problem with physio is that if somebody has benefit, they will then have to go back after a few months and have another course.
This is the cycle that we talk about. Now, how do you break the cycle of a tension headache?
With great difficulty, again, but you use a mixture of methods. You'd use physical methods, you'd use chemical methods, and whatever you can think of at the time with the medication. I think, you know, again, treatment must be evidence-based, right? We just heard that the oral appliance is the best treatment available. Evidence for that is lacking. So we can't say that, you know, publicly this is the best treatment or that is the best treatment. With tension headaches, I think it's a combination method. I have never used appliances on patients with tension headache, and we get them better.
Okay.
So
are you saying if you've got a tension headache, if you have got a tension headache, the likelihood is that you will get another one. So it's important that as you treat it, you also
they will need prophylaxis. The best prophylaxis is amitriptyline. stood the test of time. 100 years of evidence for that.
Amitriptyline.
Amitriptyline.
Only prescribed by a doctor. Msingaba ixesha liphange lasiya sizaxoshelisa siqukumbele inkqubo yethu yanamhlanje and run up our discussion on treatment of headaches or cephalgia when you return. We are watching Bonitas House Call here on SABC2 and welcome back. Mokgaiso Mogang o ile borwa mme re tla konosetsa thulaganyo ya gompieno ka ditshedimosetso go tswa go baitsanape ba gore ba ngaka ba ladiditse. Now we've already said it is one thing for us academics and doctors to talk about primary headaches, secondary headaches, categorize them into cluster headache, migraine, tension headache, rebound headache. But at the end of the day, our bodies don't read these textbooks. You can have one person having all these types of headaches or any combination of these headaches, and therefore the treatment of any person must be individualized according to their own circumstances. What would you say is a parting shot, Dr. Shevel?
The parting shot is that in order to be able to treat the headache, you have to find out where the pain is coming from.
And this will come from history?
No. The history doesn't tell you that much. It gives you a pattern. The only way that you can really find where the pain is coming from is to examine the patient. And when you examine the patient, you will find what is causing the pain. And then you can treat them intelligently.
Okay. Professor Girish Modi.
Well, I have to say, stick with conventional medicine. The whole world uses it. Stick with evidence-based, in other words, where the responses are based on sound, solid scientific evidence. Controversial methods usually imply that there are many other factors involved in the generation of the headaches. There has to be convention in what we do. Medicine is not homeopathy. I'm not being disrespectful to homeopaths, but there is science behind what we do. We have evolved in medicine over centuries. Let's use the information we have, use the evidence that we have for conventional treatment.
Three things that a patient must, if they happen with a headache, they must worry that that headache might kill them. What are those?
The red flags, when there's a change in the pattern of headache, when the headache is associated with symptoms outside the head.
Okay.
Weakness, numbness, suggesting maybe there's like a stroke-like event occurring, right? And new headache at a late age, sudden new headache.
Drowsiness, loss of consciousness?
Absolutely. No, those I would expect every lay person will know that when you got a headache with a fever and your neck is sore and you're becoming drowsy and confused, you need a hospital.
Thank you very much, Professor Girish Modi, Professor of Neurology at Wits University Medical School, and Dr. Shevel, head of the headache clinic in Johannesburg and all over the country. Banabeso, nnete ke ya morogo, letswai ke baki. Re santse go lekana rona letsatsing la kajeno more as no khadaga. Please remember to visit our website on www.housecall-easy.co.za. You can call Johannesburg 285-6180 to get more information on this show, or you can take a DVD copy of any of our shows. We'll be back next Saturday with the Surgeon General of the South African National Defence Force, Lieutenant General Dr. Vijay Ramalakan. So don't miss it here on SABC2 at 9 in the morning. Msigabao, Yanga, Nangomso. Makube Kos, Kube Hele. Argobaning Habe, Bikinitlak. Tato Haidemre. Thanks for joining us today. And from me, Dr. Victor Ramathesele, Yakaula Yaya, Namani Setla, Mutangwamlitsai. You take care.